look at the Gurd's criteria for diagnosing the fat embolism syndrome. So first we are going to ask some questions, that is, what is the major criteria of the Gurd's? So in this video we'll find this answer and learn in detail. So to begin with, we have this a major and the minor criteria. Now we'll be focusing on the major criteria. So this major criteria, it includes, there is a petechial rash. There is a petechial rash which is seen, and then there is also a respiratory. There is a respiratory symptoms with radiographic changes. So there is also the radiographic changes. So this is seen, and then there is also the CNS depression. So this is important to note. Then we also have the minor criteria. So under minor, it includes, there is tachycardia, then there is pyrexia, next retinal changes, so this is nothing but the fat or petechiae. So retinal changes, there is fat or the petechiae. Next, there is also the renal abnormalities. So the renal abnormality, it includes, there can be the oliguria, then anuria, as well as lipiduria. So just to recap what we did here. So as we discussed, the Gurd's criteria has a major and minor criteria. Now we are looking at the major criteria. Under major criteria, there is something known as a petechial rash. There is also some respiratory changes associated with the radiographic changes. Then there is also the CNS involvement, that is CNS depression can be seen. Now moving on to the minor criteria, it includes the tachycardia, it includes the pyrexia, as well as there are some retinal changes that can be, that is due to fat or petechiae. Next, there is also the renal abnormalities, kidney abnormalities, such as they can be oliguria, they can be anuria, and they can also be the lipiduria. So next we'll be continuing with other minor features. So it includes the minor, it includes the acute thrombocytopenia, and after this there is also the acute decrease in hemoglobin. Then there is also the fat globules in sputum, as well as there is increase in the ESR. So to basically, for this criteria to be valid, there has to be two major criteria. Or there has to be one major plus 4 minor criteria. So all this will suggest it is a fat embolism syndrome, that is FES. Now to recap this, we were left out with few of the criteria under the minor. So that includes the acute thrombocytopenia. There is also the acute decrease in the hemoglobin. There is also there's a decrease in hemoglobin, there is an increase in the ESR, as well as there are some fat globules which are present in the sputum. So now when we look at the criteria conditions, so to declare it as FES, that is the fat embolism syndrome, we need to have two major criteria as well as one major criteria and 4 minor criteria. When this criteria are met, it is known as a FES, that is a fat embolism syndrome. Now we'll be answering our question. So we asked one question that was regarding the major criteria. So under the major criteria, we asked about what is the major criteria in case of FES. So it includes the petechial. It includes the petechial rash. Next, it also includes the respiratory symptoms. Respiratory, that is associated with the radiological change. Next, there is also the CNS depression. There is CNS depression. So just to recap, the question we asked was the major criteria in case of the FES. So it includes the petechial rash, the respiratory radiographic changes, as well as the CNS depression. So this was about the Gurd's criteria for diagnosing the fat embolism syndrome. To learn and grow daily, please do subscribe.